Are your hormones affecting the way you look? Let's dive into how different hormone imbalances can affect your appearance. And no, this isn't hormones, I just got a chemical peel. In part one, we're going to talk about insulin resistance and diabetes, which means your blood sugar is chronically high and your insulin levels are chronically high too. Different hormone imbalances lead to different weight distributions. With insulin resistance, think belly fat. We tend to increase our waist circumference, and this means more visceral fat. This is a type of fat within our organs that's very inflammatory and puts our health at risk for things like cardiovascular disease. We can also see a lot of changes to the skin. We might see darkening in folds like our armpits and around the neck, which is referred to as acanthosis nigrans. We can also see a lot of skin takes form because insulin increases growth of things. It increases the growth of fat tissue and increases the growth of some parts of the skin. So you might notice little skin takes in the armpits or the neck too. And the face. So high levels of sugar profoundly affect the skin. We can see the skin increase its production of advanced glycation end products, which is a reaction that occurs in the skin when sugar levels are high. UV light and a few other things can also increase this production. What we see is collagen and elastin breakdown. The skin's going to look dull and lifeless and very, very crepey. And it's even hard to correct with fillers or lasers or other abrasive therapies because the damage is just so widespread. So let's start correcting this now. What do we do? First and foremost is diet. You're going to stop snacking, only 3 meals a day, and you're going to eat lower carbohydrates, which are simple sugars and starches. So think pasta, think oatmeal, no more oatmeal for breakfast, and you're going to go high protein. 30 grams, 3 meals a day, lots of green leafies, a little bit of fruit, and a ton of water. You also need to up your fiber, so think flax seeds and chia seeds, because this is going to help make you stay fuller for longer. I would also recommend my favorite berberine. Taking 500 milligrams 3 times a day works as well as metformin to help control your blood sugar as well as your insulin levels, so we can avoid all of these physical changes that come with it. Like and follow for part 2, where we're going to talk about cortisol and how it affects the way you look.